All right, so this is the three-way or CBI, the three-way irrigation, continuous bladder irrigation. And the first thing I'm going to do is identify myself, identify my patient, gather my supplies, which is the tubing, the normal saline, the bags, and whatever towels, drapes I need for my patient. I'm going to check the chart, see what's needed, and if the patient has a three-way indwelling catheter, if he or she doesn't, then I would insert it. I would wash my hands, put my gloves on, and tell the patient what we're going to do. I'm going to hang my fluid bags, and these bags are normal saline or glycine, and the bags have little spike there, and I'm going to use my tubing. This tubing, I would make sure, of course, that it's normal, and take this off without touching that. In this case, I will pretend that we'll take it off, but without touching it, I'm going to spike my bags. They're spiked. And then here's the chamber, which I'm going to make sure that there's some fluid there. And I'm going to prime it, unclamping it. So I unclamp either in the sink or a garbage can, making sure that there's no bubbles, there's no air, and then clamp it back on. So I'm going to use it. And I'm going to, my patient has to be ready, draping my patient, only exposing the area that I'm going to use, but also some barrier, water resistant barrier that I'm going to use. So especially actually the water resistance would be right here where I'm going to use that port. So I have alcohol to alcohol off the port and alcohol off this part. So I take it off, alcohol off, and I would insert it, unclamp it, and I would check the rate going slowly at first and make sure that the patient is tolerating it well without complaints. And the point is to get all the blood out. So at first it'll be bright red and then it'll turn pink. But in time, so I would stay with the patient for a couple minutes, check that everything's fine, leave this one unclamped and see how fast or slow that needs to go. And so that is the irrigation. One thing that I would do before this is empty the contents of my Foley bag and record it, empty the urine, because I'm going to be emptying monitoring and emptying it more frequently. So I will leave this one because this one is the continuous. But to remove it, of course, I alcohol off once it's done, and I would clamp it off and remove it and discard it. So this one is, when it's done, then I just discard it. Now, for the intermittent bladder irrigation or Foley or catheter irrigation, I have my normal saline and my sterile container, which with the label facing my palm, I would pour 100. The book says 100, but if we are irrigating the Foley, it's 30 to 40 mLs, and with the 2 syringe, I would use this. So 30 to 40, and I would get that. If we are irrigating the bladder, then it's 100 to 200. So, of course, my patient is trained and ready to go. I would explain what we're doing. And, of course, I washed my hands and have my gloves on, empty the bag previously. And there's a couple of ways, because this one wouldn't be the three-way, it would be the two-way. If I have needleless port, I will use that. If not, then I would use this one, alcohol off, take it, pinch, making sure that nothing's going to come out, and clamp this. I can use this blue thing to garden hose it, because the main thing is we want to make sure that it goes this way. So if I'm going to take this off, pinch here. If not, then pinch, alcohol off, take it off, and then the 2 syringe. If not, then using the needleless port, then the Toomey syringe facing the patient. This is towards the patient, above the bladder level, and then instill whatever amount I need to instill, if it's for the catheter or the bladder. Again, 30 to 40 or 100 to 200, and make sure that the patient is tolerating it well, that there's no resistance, because if there is resistance, then I move the patient, and if there's still resistance, then I notify the provider, because there might be a major problem. So once this is irrigated and it's flowing normally, alcohol off, and dispose of my materials, and make sure that this is unclamped, unkinked, and that it's flowing normally. This would have a stat lock. Empty that, record it, wash my hands, provide comfort, make sure the patient is comfortable, and that's it.